to my channel. So maybe you are in your final trimester of pregnancy, things are starting to feel a little bit more real in terms of meeting your baby, and a time has come for you to pack your hospital bag. You will notice everywhere, if you type it into Google, if you type it into Pinterest, hospital bag essentials or hospital bag checklists or packing lists are just so varied. There are so many different types and so many different ones, so it's really hard for you to kind of dig through and find out what is truly essential for you. This video is going to be focused on exactly what you're going to need, those essentials both for mum and for baby. So if you're interested in this sort of content, pregnancy, birth, postpartum content, make sure and hit that little subscribe button down below so you don't miss any more of my videos. So my first tip and the first thing that I would say to pack in your hospital bag is your birth preferences. So if you check out my website, which I'll have linked down below, I have a birth preferences template. If you're not quite sure on how you should go about that, or how to delve into the research around what sort of interventions that you are okay with versus the ones you are not okay with, have a little look at that down below. For those of you who have already taken either my e-course or my hypnobirthing classes or antenatal birth prep classes, you will know all about my love for birth preferences. My take on it is you wouldn't plan for a wedding with no backup plan for if it starts to rain on the day. So just in the same way, birth has so many different courses and routes that it can take. So I always recommend my clients preparing for a plan A, B, and C. So it means that nothing is going to come up as something new, that you are always going to have addressed that possibility when it comes to your birth preparation. Planning for your A, B, and C means that you're going to have more knowledge around those interventions and those possibilities for birth, and it means that the more you know, the less you fear. So it's a great way to help you prepare overall for your birth experience. So I always recommend having at least 2 copies with you. One either your birth partner can hang on to, or you can have inside your hospital bag, and the other one I recommend keeping as a spare copy in the front of your hospital note. So the next thing is something that might sound a little bit trivial in comparison to the last essential, but that is a super duper long phone charger cable. So sometimes it might be just to take a sweet newborn photo of your lovely baby, or maybe that is to check on the time that your baby last fed, or to use the nightlight option on your phone. But having your phone charged is essential for that. So while some people love those battery packs, I love them too, but sometimes they are not within reach. Making sure that your phone is charged at all times is really essential. So while you might think, I'll just plug it into the wall, oftentimes those charger ports are that little bit further away from you than is possible for you to reach, particularly if you've had a cesarean birth or maybe a little bit more traumatic birth. So it means that you have to be resting that little bit more, reclining that little bit more, so being mobile isn't quite as easy. Having a really long phone charger cable is essential. For all of these little essentials and hospital bag goodies, I have them all linked on my Amazon storefront, which I'll have in the description box down below if you are interested in buying one of these yourself. So my next essential might sound a little bit trivial in comparison to the first one, but that is a super duper duper long phone charger cable. I'll have my favorite one linked in my Amazon storefront in the description box down below. But the reason for this is that while you might think to charge your phone in early labor, you're going to want to take hundreds and hundreds of those sweet newborn photos and photos of your first moments together, but equally to sort of check your phone for messages or for checking the time for when you've last fed your baby. Making sure that your phone is charged for that is essential. So the reason I want the super long charger cable is that perhaps if your mobility is a little bit more restricted, if you've had maybe a little bit of a more traumatic birth, or if you've had a cesarean birth or an epidural, you're not going to necessarily be able to get up and move straight away. And for the most part, those charger ports in the wall are not necessarily one for every bed. So it means that you might have to do a little bit of a walk to the other side of the room to get that all set up. So having that super long charger port means that your partner can set that up for you before they leave. My next hospital bag essential is a water bottle with a straw. So this is actually the one that I'm going to be using for this birth, but I've also been using it in the run up to birth because staying hydrated is so important. And particularly during labor, a straw is really helpful because perhaps you are laboring in a position like on all fours, or you are in and out of the bathtub. Being able to have a straw means you can access that hydration no matter what position you are in, as opposed to having to get back into seated position before being able to take a little drink. So it means that your either your care provider or your partner can assist you with that. So that's one of my top essentials. I don't think it's this particular one, but I do have one of these straw bottles that I love linked in my Amazon storefront down below. So my next tip might seem a little bougie, but that is to bring your own pillow. So I'm going to be bringing at least one of my pillows from home with me if I do end up having to have a hospital transfer. And the reason for that is more than just comfort, because yes, certainly the hospital pillows they've got a sort of plastic cover on the outside of them, so they're crunchy, they're very thin, they're not terribly comfortable. Certainly not comfortable if you're going to be nursing your baby or if you've had a cesarean birth, so we'll need a little bit more support in terms of your positioning. But also it's a little bit of comfort from home. So it oftentimes, whether it's your dressing gown or your blanket or your pillow, has that scent of comfort and reassurance for you. One of the other videos that I have done talks all about the importance of scent therapy or aromatherapy for birth. And one of the big things is that it activates that sort of reassurance side of our brain, that part of our brain that tells us we are safe, we are okay, this is normal, and this is something that is okay to do. So having something that reminds you of that scent of home, that scent of calm, allows us to get into that space. So whether that is an aromatherapy essential oil that you have been diffusing in your home for the last couple of weeks that reminds you to sort of take a breath and remain in that left side of your brain, or whether that is the scent of your mum. So it might be one of her favorite scarves that she wears all the time, and she may have been a strong woman who you have idolized, so it brings you back to that sense of calm, but also that sense of empowerment. So scent is really powerful, and bringing your own pillow from home is a lovely sort of easy way to do that. So the next one might sound a little bougie, and perhaps it is. That is to bring your own pillow from home. So while I don't recommend bringing a white cover, try and get a nice colourful slip pillowcase so that it's not something that's going to get mixed up with the rest of the linens and the laundry. But bringing your own pillow from home has two benefits to it. Firstly, if it's going to be one that you have used recently, it's going to smell like home. So it's going to give you that sense of reassurance and that sort of familiarity that we talk about being so important in birth. We are very much instinctual beings, and our bodies know very quickly whether it is a safe place for us to birth our babies or something that feels out of the norm, or is a little bit, maybe you are feeling a little bit extra observed, or the lights are particularly harsh and they're quite exposing. Something that brings us back to that left side of our brain, takes us away from that sort of fight or flight mode, is going to make us feel a lot more calm, a lot more reassured, and as a result moving us away from that sort of that sense of fear and more towards a sense of reassurance and calm, and being a lot more comfortable as a result. So make sure and check out my previous videos all about the importance of environment for birth. But bringing your own pillow makes you feel a lot more comfortable, because the hospital pillows are particularly miserable. They're a little bit sort of thin and they've got a plastic covering over them. Not at all ideal if you're trying to get comfortable to feed your baby after birth, but it also has that double whammy of that sort of sense of reassurance and calm, and the therapeutic side of having something that you are familiar with and that reminds you of a space that makes you feel comfortable and at ease. The next thing that actually you guys recommended was to bring your own birthing ball, and I love this one because while many hospitals do have birthing balls on offer, they're not necessarily always the correct size for your body shape. So in order for you to be seated on a birthing ball and it be the right size for you, you want to have your knees at sort of a 90-degree angle where your hips are slightly above them. So anything that's a bit bigger than that, you're not going to be able to be seated comfortably on, and anything smaller smaller than that, your knees are going to be above your hips, which is not ideal for optimal positioning for your baby. So you can avoid all of those stresses and worries by bringing your own birthing ball with you. You may decide to bring it uninflated and then inflate it when you're actually up there on the hospital ward, just to make more space in the bag itself. Or you may decide just to have it bunged into the back of the car if you have enough space, and then ask your partner to bring it up, if and when you decide to use it during your labour. But being able to rely on your own tools that have been tried and tested and you are familiar with is a lot easier and a lot more comfortable for you than hoping and wishing that the hospital provided one that suits you. So the next thing that I always suggest bringing is some nice snacks for your labour, but also for post-birth. So hospital food is fabulous in some hospitals and not so fabulous in others. So bringing foods with you that you know are going to give you sort of sustained energy, a nice little mixture of complex carbs, protein and fat, means that you are going to be able to sustain your energy for those newborn days that can be really, really tiring, but also to be able to replenish your body to be able to make milk for your baby if that's how you choose to feed them. Some of my favourite snacks I have linked in my Amazon storefront down below, but I've got a couple here that I'm actually leaving out, kind of scattered around the house if I'm sort of labouring downstairs in the sitting room or whatever, or in my little postpartum kit that I have just here in my bedside locker. So these are the Squirrel Sisters Natural Raw Bites. They are a mixture of cashews, dates, currants and cacao, but they're a lovely like little nibble, and it's something that's not new or exciting for me, so it's not something that's I'm not going to necessarily have a reaction to it, or my body's not going to agree with it. During labour, I always think stay away from anything exotic and anything too fancy. Another one has actually been dug into already by my son. These are these 9 bars. I adore these. They are a mixture of sort of seeds and nuts coated with carb on the top, but they are a great easy bite with loads of energy. I also recommend bringing something that's a little bit more of a fast acting sugar, so whether that is going to be with sort of jelly beans or gummy bears or an ice pop, so you might want to bring a cooler bag with you during your labour. Something like that can be exactly what you need just to give you that burst of energy prior to pushing your baby out. The next thing along with that same vein of fuel for birth is mint peppermints or mint gum. So yes, it mightn't be necessarily what sounds good to you during your pregnancy, but during labour, not only does a strong peppermint work really nicely to sort of cleanse the palate and give you that sense of focus and give you a relief from some of the nausea that you might be feeling just as you're approaching that sort of 10 centimetres of dilation. Typically, a lot of us will experience nausea coming up to that phase of transition, but also it may have been quite a long period of time before you brush your teeth. So it might necessarily be for you, but it could also be for that sort of close contact or close support that your birth partner is going to be giving you. Equally, for someone else in the room, if it's going to have been a long period of time before they brush their teeth, you can offer them mints around. Coming towards the end of this little hospital bag checklist, but one of the things that I love to recommend clients to bring or to have an option for is some sort of lighting when it comes to feeding your baby in those middle of the night changes. Oftentimes the last thing you want to do is turn on those big fluorescent hospital lights. So instead, I recommend having a separate little light or lamp with a sort of a warm light for that purpose specifically. So sometimes it might just be if you've brought your own little set of sort of tea lights or LED fairy lights that you've been using for your birthing environment, you might just crack those out for that purpose as well, or you might choose to buy a separate little lamp for that purpose entirely. So the next thing then are your toiletries for your hospital bag. And you don't need me to tell you, because everyone is so different, what sort of toiletries you might want or might not want. Some choose to bring sort of makeup and things like that for a little light layer of makeup after birth. If that's what makes you feel good, go for it. However, I would say bring something that you're excited to use. Maybe it's a face serum that you've been dying to open, or some of those little mini samples or sets that are fantastic nowadays. However, the only thing I would say when it comes to sort of packing your little toiletry set is to make sure that you stay away from cleansers, gels or moisturizers that are heavily scented. Our newborn babies feel most reassured when they have that scent of their parent. So making sure that you're using something that's not going to mask that scent is really, really important. So on to our last two products now, and both of these are relating to sort of feminine hygiene and cleaning down below and keeping everything nice and sort of infection free. So whether or not you have experienced a tear, it can always be a little bit stingy and a little bit uncomfortable using the loo for the first time after birth. So I recommend, instead of using sort of dry toilet paper, that you use a peri bottle to clean everything down below, and then just pat dry afterwards. You can just use a normal squeezy bottle. It doesn't have to be a bottle made specifically for that purpose. It could just be a water bottle that you have filled with warm water from the tap, and squeezing it over yourself as you're actually doing a wee can remove some of the acidity and make it a little bit more comfortable for you, but also really great for sort of cleaning everything down below, so you're not aggravating any sort of tenderness that's already there, already swelling. The other thing that I recommend looking out for now is some really good maternity pads. So those pads in those early days, you want to avoid the sort of plastic backed ones, and the reason for that is that they can be a fantastic breeding ground for bacteria, because they are sending some of the moisture back and creating that lovely sort of warm environment where sort of warm, moist environments where the infection that may or may not be there will thrive. So avoiding those altogether, using the hospital pack pads, where they are like big thick mattresses. I just love them. I think they're exactly what we need in those early days. Or using the pull-up pads, so long as they are the white ones, so that you and your care provider can keep an eye and sort of observe for your lochia, that's your postpartum bleeding, to make sure that it is not too excessive. Would be my top two options. I'll make sure and link down below some of my favorite sort of postpartum maternity wear. Things are both part of the same category, and that is for sort of hygiene down below and sort of caring for that whole area. I tend to stay away from anything that's heavily scented or any kind of fancy products for that area. You don't necessarily need some of the sprays or compresses, but keeping the area clean is paramount. So making sure that that sort of first wee can be really stingy and uncomfortable, but if you bring with you a peri bottle, or a bottle that's just a squeezy bottle, filling it with warm water and allowing that water to flow over you as you urinate, can really reduce some of the stinging and sensation. I also recommend using this same idea for actually cleaning yourself down below, and then just patting dry afterwards, so to kind of reduce some of that sort of tenderness that you might, or swelling that might already be there, rather than using a dry bit of tissue paper that might aggravate it. The other thing then is your choice of maternity pads. So I actually love the old-fashioned sort of thick mattress like maternity pads. The reason for this is that they don't have that plastic backing, the sticky backing. The sticky backing on those say like the Always version are fine once your baby, if you have experienced a tear, has healed that little bit more, but in those early days you're particularly susceptible to both an infection in anywhere where you might have torn, but also an intrauterine infection. So making sure that you are creating an environment that is breathable is really important. If you have an environment where that plastic backing is sort of creating that environment of sort of moist and warmth, you're increasing the likelihood of infection breeding. So stick to the old-fashioned ones. Make sure you're changing them at every bathroom change, so nice and regularly. Keeping everything nice and clean down below means that you're going to be reducing the likelihood of any sort of infection developing.